first of all, explain to people what peptides are.
Peptides are basically a bunch of amino acids joined together with a peptide bond. How is it different from hormones that such as testosterone and other medications that we're taking? What it does is they're signaling cells that go into the body, stimulate your natural body's response, and then leave the body right away.
How important do you think it is for males to start going on TRT?
I have a couple of cases with people with depression in their 30s and 40s, and I swear, Bush, they've tried all the SSRIs in the world, like from Zoloft to like even Cymbalta, which is an SNRI, and they jump on and off of it. They sometimes feel good, sometimes don't feel good, and none of them were working. And I looked at the numbers for testosterone. This is people with low mood only, talking about mood, and I literally looked at their symptoms of testosterone, and I put them on a small dose of TRT weekly, and all of their anxiety and depression went away and improved drastically, and they never felt better. Their families are thankful, their wives are thankful.
Welcome to another Be Great podcast. Still not canceled, so let's keep going. Today is going to be a wicked podcast. He's my personal physician and private physician, Dr. Minhas. Welcome to Be Great.
Thank you for having me.
So let's just get through the initial first day jitters. Who are you? What do you do?
So my name is Dr. Rizwan Minhas with the Minhas, not house. I don't know why people make that mistake, but it's perfect.
You might pronounce it wrong.
Minhas, but it's Minhas.
Fuck me. I've been saying it wrong all this time.
I know. And I'm your doctor for the past.
Dude, look, correct me.
I did, I think, once before, but I just let it go. It's okay.
Minhas.
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 Yes.
Okay, fine. You should change your fucking spelling.
Or you can call me Riz.
Riz? Cool. I can do that?
Yeah, you can do that.
All right, Riz.
But only you, nobody else.
All right.
Not you.
Not you. You fucking can't do it.
But no, I'm glad to be here. And in regards to my background, I'm a Canadian Pakistani physician. I have a license to practice in Canada, the States, and Pakistan. I have tilted my practice more towards hormone health, sports medicine, and also the new thing, peptides. Napping into that, I have a course coming up on peptides very soon. And I work at the Institute of Human Mechanics. I have my own clinic on the side as well. And that's about it.
And you work at the ER.
Yes. I just joined the Milton ER for personal reasons. Thank you to Dr. Salman Khalid for getting me in there. But yeah.
Yeah, dude, you work like a motherfucker. You're always working. It's crazy. And how many kids do you have?
I have 3 daughters and hoping to have another one soon in a couple weeks.
Good for you. So let's go. Let's take it back. How did you start? Like what I found out about you, it tripped me out. So born in Kuwait.
Yeah, I was born in Kuwait. Because of the Gulf War, we traveled by car to Pakistan. Then my father wanted a higher education. We were 4 boys, 1 girl. He brought us to Canada, believe it or not, Nova Scotia. Nova Scotia did my schooling there. Went back to Kuwait. And then eventually came back to Canada in Toronto, where I started grade 11 and 12. And so from grade 11, 12, it was a double cohort year. So I graduated from grade 12 and then went to University of Toronto, Mississauga campus. Okay. Decided on med school late. I was actually doing a maths major. Yes, University of Toronto. And once I graduated, there weren't many jobs in mathematics.
You think?
Yeah, I figured that out not too long after. And I started doing door-to-door sales. So
Dude, that's we talked just prior to this. That's fucking crazy.
Yeah, I remember my first job with selling printers, Konica Minolta printers. And I never knew that was a company until I joined them. But I was doing door-to-door printers. And sales is a tough job, but what it does is it teaches you the ability to talk, listen to people, understand. It teaches you a lot.
And to handle rejection.
Yes, a lot of rejections, a lot. Yeah, especially in the cold winter. Right. But then I was working at Cred Bay Hospital as a volunteer because it's like I wanted to help people.
That's good.
From there, decided father was like coming from a Pakistani background. He's like, you have to become something. So decided to apply to med school. Luckily, in University of Toronto, it's hard getting to med school in Canada because of the lack of schools available and the lack of positions available. But I went offshore and I couldn't be more thankful for the opportunity given. But in offshore med school, you have to do it. You have to be in the top 10%. So you have to work 5 times harder than you would be getting med school.
How old were you at this point?
Probably 24, 25. So started a bit late. But then transferred to the United States of America, was in Ohio for my residency under Dr. Paul Rich and Dr. Swain. And then, I worked in the States after finishing my residency in primary care medicine, in my 3rd year in sports medicine, and was working in the States for about 5 years. Then parents were here, decided to come back to Canada because all my brother's parents were here, even though you get paid a bit more in the States
For sure.
Better for physicians, I would say.
Yeah.
But when I came to Canada, I wrote all the Canadian exams, because if you don't write the exams, you can still work, but you work under supervision. And no medical doctor likes to work under supervision. But I wrote all the Canadian exams and I started working here.
Okay. Why did you specialize in, before we get into the hormones and peptides and steroids, why did you want to focus on sports?
I played sports while I was growing up. Whether it was cricket, I played for had my cricket, my high school, which was Regenerative secondary high school team. I loved playing basketball, played a lot of intramurals, and like all sports, like the UFC. I've been doing jiu-jitsu for about 3-4 years. I did mixed martial arts for about 10-12 years.
I didn't know you fucking took jets.
Yeah, I did jiu-jitsu for a bit and did mixed martial arts, and with combat arts, it's on Tompkin Road.
Yeah, I know it.
Yeah, so I was with them for about 3-4 years.
Nice.
And then even when I was doing my residency, I was continuing doing my martial arts. Yeah, so I did it for a while. And
okay, so you know the problem with my fucking knee then. You know what going to roll again is going to do to my knee.
Yes. And I'm one of the ringside Canadian physicians. So any of these UFC events that happen, or the affiliate events that happen in Canada, we are one of the few doctors that does that.
Nice.
As a ringside doctor, yeah.
Okay, so you went into sports medicine and then you started to specialize.
Yes.
And I actually think from two perspectives. When we take a look at the future of medicine, I think we have to be more self-reliant on our own health. We have to do whatever we can to not only extend the lifespan, but the longevity, not just the longevity, but how good of a life you're living. Like, I don't want to be some old fuck at 90 to 95, not doing anything, having someone carry me to the toilet so I can take a piss, right?
Yeah.
Like, I want to extend my life, but I want to have it performance-based.
Absolutely.
And that's how you and I met. So full disclosure, I fucked around with steroids when I was younger, and I screwed up my hormonal cascade. So I have been on TRT for probably 15 years. And because of my sensitivity to testosterone, without belaboring it, and he'll be better versed to explain it to you, typically when you're taking TRT, you take one shot a week or maybe twice a week. Some people even take it once a month. But for me, whenever I would take it, my estrogen would spike and it would just fuck me up. And it was Riz here that basically put me on microdosing, where I take it every day. And since then, everything's been perfect. Full disclosure, I am on TRT, I take GH and peptides. I fully believe that you should be responsible for your own health, and you should do whatever you can to maximize your performance, your longevity, and your enjoyment of life. So there you go. So Riz here has been instrumental, and as I said, he's my private physician, and he helps with everything, blood work, maintenance, everything. So how important do you think it is for males to start going on TRT, and at what age?
Yeah, no, that's a really good question. So in regards to, I'll track back a bit. So you talked about the lifespan. Yes, it's important to have a longer lifespan, but health span is important. What you were getting at, health span is basically living longer, but with better lifestyle, with no diabetes, with no cholesterol issues, with no heart disease, right? Because the biggest cause of deaths worldwide is still heart disease. So how do you prevent heart disease? By lowering your cholesterol, and prevention is the best. Just by going on a cholesterol medication late into your 60s when you already have plaque development is not the right answer. We have testing now, such as little life protein A, which is hereditary cholesterol that can be picked up in the body. You only need to test once. But like just putting on smaller medication, getting tested appropriately in your 20s, 30s could prevent you from having a better lifestyle. It could actually make you have a better lifestyle in the long run. So better health span along with a better lifespan.
Nice.
Yeah.
Okay.
In regards to testosterone replacement therapy, some people need it, and whereas some people may not need it, but it all depends on your symptoms. In regards to your case, yes, when you take testosterone, 1 injection, 2 injections a week, your receptors are sensitive and your aromatization is sensitive.
Yeah.
And not everybody is the same. So in your case, microdosing is best, because if you do take doses every day that you take and put it into one big dose, injected one time, you have such a big aromatization.
And I was so sensitive to that shit.
Yeah.
It was crazy.
It is. And is testosterone replacement therapy important? We're using replacement therapy. Therapy is the word. We're not using abuse. So the goal is to go on the lowest effective dose if and only if you have symptoms.
Right.
Yeah.
So what would be the symptoms?
Symptoms could be ranging from anywhere from having difficulty gaining muscle, having low libido, having pain through your joints, having foggy brain, unable to think clearly, It could be, it's a far array of symptoms because testosterone just doesn't apply to the way you look, but it's the way you feel as well.
It's very important for mood as well.
Yeah, it's very important for mood. Yes. I have a couple of cases with people with depression in their 30s and 40s. And I swear, Bush, they've tried all the SSRIs in the world, like from Zoloft to like even Cymbalta, which is an SNRI, even like for like anxiety medications like fluoxetine or Prozac. And they jump on and off of it. They sometimes feel good, sometimes don't feel good. And none of them were working. And I looked at the numbers for testosterone. This is people with low mood only, talking about mood. And I literally looked at their symptoms of testosterone and I put them on a small dose of TRT weekly, and all of their anxiety and depression went away and improved drastically, and they never felt better. Their families are thankful, their wives are thankful, and they never felt better. So none of the sometimes people don't respond to medications, and all you need to look at your hormones, and it might make a difference.
Every time I speak to someone, let's say generally in their 40s, and they'll come to me and they'll say, I'm not, my sex drive isn't what it used to be, or I'm very lethargic, I'm tired. I'm like, dude, go get your hormone levels checked. That's my fucking de facto answer to everybody now.
Yes.
Just simply because you just should know where you stand hormonally.
Yeah.
And it has such an impact on your life. So for men, generally, sometimes people, correct me if I'm wrong, could be in their 30s and suffering from low testosterone.
Yeah, there's cases they're in their 30s, whether it's low testosterone from genetics, whether it's low testosterone from prior concussions and sport, or whether it's low testosterone just they suffer from some type of depression. They haven't been working out. Their meals haven't been that great.
Yep.
And that can affect your epigenetics and affect your hormones as well. So it could be many reasons. Everyone's different, but you know what? The new trend is prevention is the best key, right? So prevention can save your health. I actually recommend for these athletes to get their levels checked, at least at the baseline, in their 20s, 25s, and know what their levels were at this age, and then they'll know how their decline has happened over their years. So it should be part of your labs in your early years as well.
I agree. I know a lot of fighters who have suffered from concussions who have symptoms of low testosterone. Like I won't, diagnose them, but I'm like, dude, just go get your fucking levels checked. And that way you'll know. Tell me what your test numbers are, your free test, your total test, and then I'll send you to Riz.
That's exactly. But free test, total test, thyroid. It's important to make sure that thyroid numbers are important. All you get it bioavailable testosterone. Along with that, also get your one-time LP(a), the cholesterol marker. These numbers are important. Yeah.
And what about your DHEAS?
DHEA you can also check in the beginning. Make sure you also get, if you're not on any type of recreational drugs, which you shouldn't be, get your FSH, LH also done, which is a follow hormone and the luteinizing hormone.
Right. Drugs are bad. Yes. And also I would suggest getting your estrogen levels checked.
Absolutely.
Your estradiol. Yes. Just so you know, like for me, dude, my numbers, they were fucking ridiculous.
Yes, I remember.
Yeah. Dude, guys, if you have any symptoms of any of what we discussed prior, just go to a doctor, go to a lab, get a rec form, get your test levels checked. Your life will be so much better once you have that under your belt. Yeah. So as we discussed, there's many facets to test. As you said, you could take tests for replacement, and then you can take testosterone and or other steroids for sports performance. Now, I'll be completely frank. I have no issues with taking steroids if you're going, as long as it's on a level playing field. You shouldn't be taking them to mask them so you compete and have the edge. But there are advantages to taking steroids. It comes down to the abuse. Are you abusing them? Are you having a detrimental effect on your body? But I think anything taken in moderation can be good for you.
Yes. It's a fine line. There are a lot of sports. So as a sports physician, we have to follow the WADA guidelines.
Yes.
And most people have their own guidelines, but obviously you can't be abusing it. And if you do any medications that are on those prohibited lists, you have to get an exemption form done. But in cases of abuse and treatment therapy, the goal is to just use the lowest effective dose. Why? Because if you use a higher dose, testosterone replacement therapy dose, what can happen is you're increasing your risk of atrial fibrillation, which I've seen like 2-3 cases over the past 5 years, even in my practice. You can have increased risk of acne, mood. Actually, instead of making more stable, it can get worse. So it's important to use the lowest effective dose. There is a fine line because then you get into aesthetics and you want to look bigger.
Yes.
But that's not why you should be on it. You should be on it for just overall longevity and health.
And to that point, though, there are going to be people, regardless of what's said, that want to go down the road of taking PEDs.
Yeah.
And all I suggest to those people is just get your shit checked. Make sure that you're still healthy while you're doing it. When I did it, dude, it was fucking bro science. It was like, dude, you got to take a fucking cc of Deca, and you got to take a Sustanon. You got to do all this, and there's no intelligence, and you're just gutting shit with no science behind it.
Yeah.
And you pay the price, which I did. So if you are going to go down that road, just keep your shit in check.
Yeah, there's many ways of replacing it. So like for example, like for younger people, which I don't like taking young people because it affects their fertility. So I normally recommend people who are done having kids and actually have symptoms to get replacement therapy. For younger folks who do have symptoms and they still want to maintain their fertility, I recommend not going on testosterone as a drug, or whether it's cypionate or enanthate injections. I do monotherapy with HCG, which is human embryonic gonadotropin hormone.
Yes.
And that can actually stimulate your testes to make natural production of testosterone and preserve your fertility.
Right.
Yeah, all with that, you could probably take some Clomid. So let's put that to the side. But even like injections is not the only way. There's bioidentical creams.
Yes.
There's also pellets.
Yep.
And those are equally as effective. Some people prefer the pellets. Why? Because you don't have to do anything to felt. You can just, it's like a cylindrical, probably a centimeter or so. You just place some pellets into your flank area and they're slowly absorbed over the next 4 or 5 months.
Is it a controlled absorption?
You know, it varies depending on the pellets, how they're made, but it varies. It's actually, the absorption is based on your cardiac output.
Okay.
If you're not moving, if you're not active and alert, absorption will be low. But if you're moving, working out, absorption will be better. But if you look at numbers, they're getting better and better at the way they're being absorbed. But so far, the injections, the benefit of the injections, whatever you dose is what you get. Even with the creams, you can get absorption is different depending on your skin type.
Oh.
But yes, so the creams, a lot of people have issues because absorption is limited, and other issues, you can pass it on to your partner.
Yes. So when I first started going back on TRT, I did take the transdermal gel. And dude, I was putting it fucking everywhere because I was taking such a high dose, because this was before I met you. I had on my thighs, on my fucking ribs, my stomach, my arms, and I was just one big patch of test.
Did it work?
No, like, as you said, the absorption of a transdermal gel is, it's too problematic. I needed guaranteed this amount, and listen, taking those fucking spikes once a week, I didn't like it. Microdosing, you're taking small insulin needle every day. It's perfect.
Yeah, it works good for some people who don't mind the injections daily. But yeah, microneedles is okay. The benefit of that is you don't get an elevation in your estrogen as much.
Yep.
And you don't get an elevation you don't get much hemochromatosis, which is an elevation in your blood count.
Yes. Yeah.
So you prevent that by taking microdosing.
Yeah, I come to you, I think I get my blood checked every 4 or 5 months, and you look at my labs and we're good to go.
Yeah.
So for a woman now, you know, as she gets into perimenopause or premenopause, what's your advice to them?
You know, I do treat some women as well. Women, obviously, it's a bit more complicated because you have estrogen and progesterone.
Yeah.
The problem with testing women at perimenopausal stages are that their hormone is so fluctuated, so the tests don't make too much sense. But you know what the mechanism is. They're reaching menopause, so the estrogen is going down. And what are the symptoms of low estrogen? Symptoms are, you know, you can have like physical symptoms such as vaginal dryness, but you can also have other symptoms such as hot flashes and they also need hormone replacement therapy, especially in the perimenopausal, postmenopausal stages. But a lot of doctors forget about testosterone as well, because testosterone is equally important in the female as much as it's important in the male.
Isn't that the primary hormone for women for sex drive?
It is. So there is approval for testosterone for female with hyposexual disorder.
Okay.
So yes, so testosterone has helped with females who have low libido as well. In fact, if I talk about testosterone in females, it's more prevalent in their body compared to their estrogen. But we don't test it often. We forget to prescribe it. But it's important even for their brain fog, important even for their libido, and it's important for their muscle mass.
And not being a bitch.
Yes, I'll leave that to you.
Yes. I'm kidding. It's a fucking joke. Yeah. We jokes. We have jokes. So if we move past the testosterone, one of the most interesting things to me now, on one hand, is peptides and SARMs. SARMs, I think, is just a little too unresearched.
Yes. But before we move on, I told you the importance of testosterone, but it has changed a lot of lives, especially in my practice.
So give me some examples of people that have helped.
Yeah.
And maybe some people will recognize some of the symptoms or the stories and it'll help them along.
Yeah, so I take courses on replacement therapy. I've taken courses over the past 5 years, right? And I speak to a lot of other testosterone docs, and they share the same stories. I have a couple of people in my practice, now their wives are so happy with their male partner because they thought their male partner wasn't interested. They were at the brink of divorce. In fact, they didn't need a divorce lawyer, like I told you. They just needed a tiny bit of testosterone replacement therapy. So, it's not only helped the male, it actually affects the whole family.
Sure.
So once a small dose of replacement therapy for the male gets their libido back, they're more interested in their partner, the wives are happy, the kids are happy, it changes the whole family dynamic. And it's not just one story, Bruce, there's so many stories similar to that. And not just with me as a physician, I have a friend who's a physician in the States. He shares the same stories. His name is Dr. Sean. He is in Florida, and the exact same stories. So it's across the whole globe. But the goal is to just use it in a safe, effective way.
Yeah, agreed. I think no matter what you're going to do, because as we said, if for us to say don't take steroids, there's going to be people that do it. And so just do it smart. Like just get your shit checked to make sure you're not hurting yourself in the pursuit of trying to, I mean, a lot of the times it's for the visual appeal of it, right? There's some steroids that coming from jits, there are some steroids like Deca that just completely fuck up your joints.
Yeah.
So there are some steroids out there that from a performance base is horrible, right?
They affect your other organs too, right? If you're abusing it, they affect your liver, they affect your joints, they affect your muscle, they affect estrogen affects your, the way you feel, even affects your libido, high amounts of estrogen.
I know.
And then you try to combat it by taking aromatase inhibitors. So you drop your estrogen so low that estrogen is important for the heart. As you know, it's also important for your bones. So you drop your estrogen so low that you lose the protection of your heart, you lose the protection of your bone. So it becomes like a cycle that you don't want to do. So
I guess I went through that cycle because when my fucking estrogen level was so high, I did go on those aromatase
inhibitors, right?
Thank you. And then my estrogen plummeted, and then I had the same side effects and the same mood swings that I had when my estrogen was high. It was just a vicious circle. Estrogen climbed, dropped it, felt like shit, went back up. It was like, honestly, microdosing was such a huge gift to me.
Yeah, I don't remember ever prescribing estrogen blockers.
No, this was prior to you as well. Like when you and I met and I finally came to you, you're like, this is what we're going to do. And then we switched everything up, and it's been a few years now and I'm disco.
Yeah, perfect.
So the most exciting thing, first of all, explain to people what peptides are.
So peptides are unique is peptide is basically a bunch of amino acids joined together with a peptide bond. How is it different from hormones that such as testosterone and other medications that we're taking? What it does is they're signaling cells that go into the body, stimulate your natural body's response, and then leave the body right away. So we are doing a lot more research on peptides. There's so many peptides that even as a physician, I can't keep up.
I know.
That's why I'm taking a course coming in September, but we have been using peptides. The most common peptide you'll hear right now is BPC-157. You'll hear a bit of TB-500. It's also thymosin. But then people don't know Ozempic. It's a GLP-1 agonist. That's a peptide. Semaglutide, basically. And then there is Retatrutide, which is also a peptide, which is in research currently, but a lot we're using it in the States. It's similar to Ozempic, but Ozempic has just one mechanism of action, which is the GLP-1 agonist. And then Mounjaro is the next step, which has a dual agonist. It's a GLP-1 and a GIP agonist. And I'll get into the functions of the mechanism of action, but the Retatrutide is a triple agonist. It has the GLP-1, the GIP, which is now Mounjaro, plus it has glucagon. So why are people using it? They're using it threefold. Initially, these medications were there for diabetes.
Yes, I know.
But now it's changed the landscape because for people who are resistant and could not lose weight, and they're using for weight loss. And now, plus on top of that, a lot of people have this metabolic inflammation in their body, whether it's high amounts of cortisol or IL-6 cytokines. It helps, these medications have shown to help decrease metabolic inflammation.
Really?
Yeah, so a lot of patients who come to me who are also on testosterone but can't get rid of their inflammation, they feel inflamed, they feel tired, fatigued throughout the day. Yeah, a small microdose of whether it's a Mounjaro has helped them get rid of their some of their pains and their inflammation in the body.
Now, you mean when you're saying metabolic inflammation, what do you mean by that?
So metabolic inflammation is what it can happen in forms of even diagnosis, such as insulin resistance.
Okay.
When your cortisol numbers are high, whether it's from a lack of sleep or from poor nutritional habits over the past years. And it's hard to monitor or check these, but there are lab work that you can do to check this, such as the C-reactive protein, which is an inflammatory marker, and IL-6. IL-6, we don't really have lab work for it, but it's they're using it in research to check inflammation. But that other forms of inflammation could coincide with diagnosis such as non-alcoholic fatty liver disease. Yeah, so like that. But what are the symptoms of metabolic inflammation? Again, similar, you feel joint pain, brain fog, feel fatigue throughout the day. Those are similar.
Okay, but one could very easily assume that their joints are sore. Like my joints are always fucking sore.
Yes.
Now that's what I know that's from training.
Yes, that is true.
Right. And then sleep, I train twice a day. So the fact that I'm tired throughout the day could be attributed to that. Do you not think, because my fiance used to work in a medical clinic, and there'd be people coming in all the time from what they called Ozempic face. Like their face is drawn in, and it's just become such, like, what I don't like is these magic bullet tricks where people, I'll eat what I want, I don't have to fucking train, and I'll just take Ozempic.
Yes.
And it is effective, but there are side effects, there are negative side effects of taking Ozempic.
Absolutely.
And I think we are glazing over that. And even when, like, I've talked to people saying, listen, dude, you're taking Ozempic, make sure you up your protein, make sure you are doing weight resistant exercises, and they don't want to do it. They just see the number on the scale dropping, not even caring if that's muscle mass, because Ozempic isn't a muscle wasting. You're actually stripping your body of muscle.
Yes, you are.
Okay. I mean, on every level, that's not good. Your metabolism's going to drop. And then because of that, it's going to be easier for you to gain weight. But it's a circle. I think anything can be used as a tool, but when it's used as a crutch, I think that's a mistake.
Absolutely. So you nailed it. It's an adjunctive therapy. So let's separate two groups of people out. Let's separate the diabetics and people with heart disease on one side. So those people need it to prevent death, because for diabetes, it helps control their sugars really well. And for heart disease, it's being used to prevent heart disease, FDA approval for heart disease. So let's put those people on the side. Now let's take the people who actually want to lose weight. The biggest way to lose weight is through calorie restriction and improving your protein intake, making sure you're not having too many carbs even during that calorie restriction, and exercising, whether it's gaining muscle. The more muscles you gain, the more metabolic active your body is, and more easier it is to burn adipose tissue or fat. For those people but again, it's not as easy as I'm saying it, because certain people can lose the weight, but certain people cannot. And for people those that despite doing those lifestyle changes cannot lose weight, this is a great adjunctive.
Sure, but how the percentage of the population that is so resistant to the benefits of caloric restriction and energy expenditure by exercise, you're talking a small percentage of people. Like there's a fucking worldwide shortage of protein because people are on Ozempic.
Yes. So there might be a small percentage. It's hard. I haven't seen any numbers there, so I can't speak on that. But I do know that if you take Ozempic with appropriate exercise routine and appropriate nutrition, you don't lose much muscle. And how do I know that? I actually do an in-body test of my patients, whether you want to do an in-body or you want to do a DEXA scan or you want to do a body pod, right?
Yep.
So any of those tests are good to take before you take Ozempic, because it can monitor your amount of fat percentage that you have in your body and the amount of muscle you have in your body. And then you can repeat it while you're on Ozempic 6 months later. And I've done it on people, and when they're working out and eating correctly and then taking Ozempic, they don't lose much muscle. So yes, they can cause sarcopenia in the person who's not doing these lifestyle changes, but this medication is not even approved to be used solely. Right. So when they say use this medication, they say along with lifestyle changes.
Right.
So I don't know. Okay, let's put those, the dosage is higher. The higher the dosage, the more weight loss you can have. But then if you use it for inflammation, a lot of doctors and patients, they're microdosing it.
Okay. So it'd be daily?
You can use it daily, or you can use it twice a week.
Okay.
Instead of weekly. But you don't have to use such a high dose for a metabolic, but you can use a small dose.
Okay.
And the only way to tell is by using it. And I swear, like these patients who are already on optimal therapy, I gave them a small dose, and their joint pain have it's gone. They are more alert and active. It's just amazing. It's amazing. You might have to give it a try.
Yeah, now you fucking piqued my interest.
Dead series.
So the joint pain I feel from rolling so much, or from striking, the Ozempic would still help.
I wouldn't use Ozempic. I might use Manjaro in your case.
Okay.
But you would only know once you tried. But keep in mind we have to monitor it very closely, because sometimes joint pain and tendon pain can also happen when you're taking testosterone working out very heavy, because sometimes the tendon health, like you gain muscle, but then the tendons try to play catch up. And
Right.
a lot of people who work out heavy on replacement therapy or use too much of testosterone, they
Yeah, my dose is very low.
yeah,
In a way,
yours is great. But I'm talking about other people, they can have they develop tendinitis on doses of TRT when they're not taking care of their tendon. So how do you take care of the tendon? You have to change your workout routine. You have to work on tendons, whether it's slow negatives or whether it's taking collagen supplementation and vitamin D and fish oil. So make sure you worry about your tendon health when you're on TRT. But in your case, I know you do that. Yeah, so that's what I'm saying. I'm not worried about the testosterone dose in your case. In your case, I would definitely try a trial stuff. And how long would your trial be for? Literally 4 to 6 weeks.
All right.
And you'll notice a difference. And if you don't, just come on the podcast and say Dr. Minhas as well.
Full shit. Yeah, I'll try it. Okay, that's we'll hook that up. Going back to the peptides, yeah, I do take the BPC 157. I do take the TB 500. I take the BPC 157 both orally and then also for my knee injury, which you've hooked me up with. Well, they call it the Wolverine stack, right? Because it's so beneficial in rejuvenation.
Yes.
But there, as you said, there is a host of peptides. And as I understand it, if you take HGH, that's the complete length of the DNA strand, correct? And peptides are just fragments of that.
Yeah.
How would you explain to someone the benefits or cons of taking either GH or peptides?
Let me say something about GH. I think we still need more research on it. I know it's a lot of patients that do take GH. Growth hormone is known as an anti-aging drug nowadays, but I'm not a complete believer. I use it for recovery in some patients with tendon injuries. Yes, I have noticed the benefits in patients who are taking growth hormone, like such as elasticity of their skin, better recovery from workouts, body composition has improved. But again, is the longevity, do you get longevity with growth hormone? I am not sure, because they've done longevity research and they found out that patients who are living 100 plus years have actually low or normal levels of growth hormone. So growth hormone can affect your phosphodiesterone. So please do your research on it, because I think it's equally important when patients come to physicians, they should do their own research and ask the doctor as many questions. So I do use growth hormone for healing in some cases. In regards to peptides, again, I use them mainly for healing because there's no FDA approval for it for long-term use. But so far, research has shown, not just now, it's not 3 years, 4 years, it's 20, 30 years of research on peptides, especially the BPC 157 and the TB 500. It's shown to even enhance testosterone replacement therapy. It's shown to increase inflammation of the pituitary axis, and it's also shown to heal tendon injuries, right? For those injuries that are resistant. So I use it for injuries sake right now. Do I use it long term? No, I leave that to the patient to do their research and decide, because there's no scripts for it in Canada. The people buy their own, but I tell them to make sure the source is appropriate source in the pure.
Yes, there's too many people making that shit in bathtub kind of ways.
Yeah, Health Canada. I think there's a company that's trying to get Health Canada approval, and hopefully it's do it.
Well, the BPC 157 does have Health Canada approval.
Yes,
I'm not sure.
old version.
Yes. And the TB 500, I'm not sure if it does. Is it?
500 does not, but there's a growth hormone like peptides, serum morellin. Yes, they have approval on that. And the TB 500 should, because it's shown good functionality in regards to healing on injuries, should get some approval, but so far not in Health Canada. It's going to take a while.
So one could, if they want to go down that route, as opposed to taking GH, they can take ipamorelin and CGC.
CGC 1295, CJC 1295, and ipamorelin. They're a combination. They could take that as well. Growth hormone is, by the way, very expensive.
Very.
Yeah, so you're paying like close to, in Canada, I think $500-$600 for like a month, a unit a day supply. And in the States, I'm not even sure, probably more expensive. And there's no coverage for it. Yes, people have insurances, but you have to show the full levels of IGF-1. That's right, before you jump on it. But yeah, in that case, I wouldn't spend money on it because again, I'm not sure if it's longevity drug. If you're taking it for recovery, yes, I understand 2-3 months is fine. I would actually go with the peptide more so because again, these peptides signal the body's natural response to enhance,
Yes.
and then leave the body, and
Very
it's cheaper.
significantly. There's the fear, like typically when I speak to people about GH, one of the common fears is that it can activate cancerous growth cells. Is that true?
You know what? There's no research that shows that it can cause cancer, but for pre-existing cancer within the body, can it help replicate itself? Potentially. Still unsure, but yes. But would I be putting on a patient which has already diagnosed cancer? Absolutely not. It would be like a major contraindication. But does everyone with cancer know that they have cancer? Not true about, right? So you have to be very careful when using it. So far, like if you talk about cancer, we have screening guidelines. Yes, whether it's USPSTF guidelines, we have screening guidelines for colon cancer, lung cancer, prostate cancer. There's a blood test that you can do.
Yes.
But it's in discussion with the patient and the family doctor to decide if they want to do it. I do it on my patients, especially if they're on replacement therapy.
Okay.
And the guidelines for the colon cancer is usually if you have no families, you start at the age of 50. For lung cancer, start at the age of, especially if you're a smoker, right? So to start around the age of 60 as well. But again, besides those, these are not the only cancer. There's pancreatic cancer, and yeah, not everyone with cancer know that they have cancer despite the family history. But most patient comes through with a bunch of family history of cancers. I probably would not even recommend going on any of these medications.
Even test?
Growth hormone, testosterone. I'll say this about there have been a lot of research linking testosterone with prostate cancer, and they have been debunked.
Yeah.
So there is no current research that shows that testosterone causes prostate cancer. But if you do have current prostate cancer, it's important to have good relationship with your physicians in the area. So I always send my patients who have elevated levels of PSA to the urologist, and then with the help of the urologist, we decide whether this patient should continue it or be off of this.
Yeah, but then you got to weigh the pros and cons.
Yes.
Like if you're suggesting they don't go on testosterone replacement therapy and they need it, their life is going to be shit.
Yes.
So what's the fucking point of living longer a shit life? I'd rather just, have a good time at the party, and then when my number's up, there, hasta mañana.
Yeah, at the end, it's autonomy, so it's definitely a patient decision as well, along with it's supposed to be a group decision with the patient and the family and the physician. But yeah, that's why urologist is important, especially if PSA numbers are elevated. But yeah, so far I wouldn't worry about the linkage of testosterone with prostate cancer.
Okay. So in our discussions, and we're talking about Ozempic, people have a one road to a solution. Whereas for complete health, it has to be a combination of physical activity. It has to be a combination of good food. I do believe in its supplements via nutritional supplements and also pharmaceutical in terms of if you're going to do TRT, if you're going to take peptides, if you're going to take GH or any of those anything in that realm. And that I believe mental health is also very important in that equation.
Yes.
And I think a total health should be a combination of all those factors.
Absolutely. So it starts with good lifestyle, which starts at home, good relationships at home. Mental health is affected by the food you intake. Mental health is also affected by your sleep. And it's also affected by exercise. So you need to do those things along with, and sometimes they're not good enough, but at least you should be doing those things. And then if you want to use any adjunctive therapy, then you have these supplements. And there's a lot of great supplements, especially we don't get enough sun in Canada. There's vitamin D, which is not only important for energy, but it's also important for your hormones, right? Then there's zinc, and then there's magnesium, then there's and then for better results, we have black pepper. So shout out to MagZ. You guys came up with a good supplement. I actually like it. That's why I made a video on it. So yeah, so I think supplements are important. And then you're reaching medications that can help with inflammation because certain things you can't fight off. You can't fight off your genetics sometimes. So sometimes you do need medication, but again, they're injunctive to a good lifestyle habits.
Do you think via lifestyle you could overcome genetics?
Maybe not genetics, epigenetics, yes. Yeah.
And what's the difference?
The difference is genetics. So, for example, like say that you have familial hypercholesterolemia, and then you check your cholesterol panel, and even though despite such good eating habits, despite such good eating habits, your exercise routine, you check your LP little a, it's always elevated. That's passed on for family generations. So that you can't really affect by the lifestyle changes you're doing. But there are certain things, such as if you maintain a good sleeping habit, lifestyle habit, then your body responds a certain way. So that's called epigenetics, how it responds to certain medications, how it responds to certain food that you take in.
Would you be of the mindset in the future if we could alter our DNA and start, like, isn't there something called CRISPR where you can actually take out faulty genetics?
Yeah, I heard about that company. I think it's still in the working stages, so I'll have to look into it. But yeah.
Okay, but let's play that out, because essentially you're playing God now at this point.
Yeah.
And I do believe in birth, couples can actually start to alter the DNA of the child where they can give it a particular eye color, or they can start modifying. Is that something that is readily available, or is it just in the fringes?
I think it's in the fringes, but with anything, there's always a trade-off.
Okay.
There's always a trade-off. I think as humans, when we're made, we're all gonna have we can't all be perfect, but at the same time, whatever we've been given, we should work with the hand that we've been given. But then once you start playing around with certain things, you might get what you want, but then there must be a trade-off. So we're there. Same thing with growth hormone. You might look young, but the trade-off is that you might die quicker.
Okay, but then a personal question. Wouldn't you rather live your life now to its fullest potential and maximum life, as opposed to extending your life, eking out a living, just a fucking mediocre living?
Yes, that's a good point. That's where I think there should be good balance, right? So that's a fair point, but it should be a good balance. I don't know how many years you shut off. I wish there was a number we could come with by tracking it. If it's a few months, I guess it does better.
Yeah, I'd rather do whatever I can do now. I mean, because in essence, with all these things that we're doing with the hormone replacement therapy and the peptides and SARMs and GH and whatever else is coming down the road, and all the other shit that I do in order to perform, like I told you, I have that hyperbaric chamber coming in a couple of weeks. So all of these things, I'm doing whatever I can to get whatever is available to maximize my life. So if there was something that came out that would allow me to lower my metabolic age, I would fucking do it.
I understand.
So
I understand.
But as you said, though, there comes a point when we are playing God. We are completely, and I guess that's more of a theological perspective, but I would do it. If someone would come in and say, listen, dude, you can take this and live forever, I'd be like, fucking sign me up. Well, let's say taking your eyes, for example.
Yeah.
I understand that there's procedures coming that can help reverse the degeneration of your optical nerves, where you can actually start to see better. You can start getting your eyesight back to 20/20 vision.
Yes. Because as you get farsightedness, you can see better close by. But yeah, there are ways that you can improve that now. Yes.
Yeah.
Yeah.
I'd be all for that.
Yeah.
In terms of the future of science, what do you think is coming down the road? Do you think there's going to be a point where we could live to 150, 200 years?
Yeah, we're already living 100+ years. Do I feel like if we can live to 200 years? Probably not. Okay, that'd be amazing, but I don't know as of yet if we can reach there. We are so slow in regards to even getting approval for these peptides over the past 20 years. And if it does happen, it's going to be a very, very, very painfully slow.
So why do you think Health Canada is so slow on shit?
I think they have to have the right people running the right teams. So they have to have the right people running the right shows. I think we have wrong people in wrong positions personally. Plus, I think they're too busy with helping non-Canadians.
That's an interesting perspective. Well, I didn't think you were fucking going to go there. Yeah. So what do you think of the medical system in Canada? Like, so everyone in Canada right now is, free fucking Medcare. But dude, I'll be straight with you. I think there should be a 2-tier system in Canada. For those people that want free system and they want to wait fucking 11, 12 hours in emergency, cool. I'd rather plop down my credit card and get seen by someone right the fuck away. And, you and I know a number of doctors. I think doctors are unappreciated. I think they're over fucking worked, and I think you're underpaid.
Yeah, the cost of living in Canada is so high that I think the payment for physicians over the past 10 years, 20 years hasn't really changed much. That's such a long topic to discuss. In regards to patients, I would rather talk about patients and the fact that we have universal health care. To be honest, it is a blessing for most patients, especially in countries that don't have this.
I wouldn't say eliminate it, because I think it is necessary for a certain demographic people.
For more patients, but I do think they should have lower their laws on private healthcare and should allow it to happen if needed. But yeah, I think it should be allowed. private health is important. Some people do need more than other people. And I think,
And some people don't want to fucking wait.
yeah, so I think they should be less stringent on that aspect.
So what is the law in Canada for private healthcare?
I'm not too sure on it, but I know there's a fine line. I know they have some rules against it, especially if you're working in the hospital setting. But I know there's a lot of doctors who do memberships now for else. There's Medcat as well that are doing membership for their own patients, but they have to follow. I think it's a loophole that they're trying to. It's a loophole that the way they're doing it is through a loophole. But they have to be open to the public as well.
Okay, but don't you think private healthcare would ease the pressure off the public healthcare?
Maybe. But then all doctors would be signing up for private health.
That's true too, right? Well, because that goes back to my point. You guys are fucking not paid enough.
Yeah, they can improve on that as well. Yeah, they should definitely improve on that. I have a lot of doctors that overwork. It depends on what you value. I enjoy what I do, and I do make less than a lot of my fellow physicians. Like I have fellow physicians working in the urgent care clinic, and believe it or not, they see like 110, 20 patients a day.
Oh my God.
Every day. And they make close to like 120,000 a month. And then if you take a sports physician, an average sports doctor, I don't know what an average sports doctor would make, probably around 30 to 50K. So it's like not even like comparable. So we can easily do that, by the way. So I can easily go and leave this and do urgent care and try to make that 100K a month by seeing that many patients. But then it becomes a numbers game. And are you in it for the money, or are you in it for what you like doing and helping people?
Yes. So for there, I think there should be a balance.
Yes.
But I think because what you do is so important that you should be compensated fairly and not burn you fuckers out.
Yeah. So yeah, I know it's things. Some people are getting burnt out. But
For sure, man. And we're just allowing so many people to come into Canada that the medical system is just fucking bogged down.
yeah, it's definitely different in different parts of the city. Those 100 since you bring that up, so those 120 places are actually in Brampton, whereas in the other parts of the city, there are not that many.
Right,
Okay.
exactly. And you can fucking figure out why that's happening. Thank a liberal for that shit. Where do you think the future of medicine's going?
I do believe the future is brighter because the biggest things that we've improved over the past 30, 40, maybe even 100 years is that we were dying earlier because of heart disease. That's the number one killer. And just because we have these statin drugs, which a lot of people do hate on, but they made us live longer. And I do think our longevity can increase from an average longevity, which in Canada is, I believe, 81 years right now. Yeah, you could increase that, but I think we should focus on not only longevity, but the health span. For sure. I think that's where healthcare should go. I don't know if it's going that way, but that's where it should go. Right now, we have an obesity pandemic. Yeah, we have, that's the biggest issue because obesity can increase rates of cancer. It can also increase rates of poor metabolic health, diabetes, and you end up putting more money into the wrong resources. So we have to improve that. I think that should get better. And I think it would fix a lot of issues. Fixing the obesity pandemic would fix a lot of issues.
And what pisses me off about that are and I don't want to hear people bitching about, well, genetically I'm designed to be fat. Fuck you, okay? And we're talking, that's such a small fringe demographic. I'm talking for the mainstream people that are overweight, that's self-induced. And I have no sympathy for that shit. It's like an alcoholic, someone who drinks or does drugs. They're willingly doing harm to their body. And yet the medical system gets all fucked up because of people doing that.
Yeah, that's true, but not everyone has the same willpower to improve themselves. But it's not like the government's helping them.
No, they're making it.
Foods, the good foods are so expensive. The worst foods are the cheapest. So as the government is actually cared about people, they would do the right things. But unfortunately, they don't care, and we have the worst. Yeah, they just don't care. They should work on improving grass-fed beef. The prices on that, organic food should be much cheaper.
Yep.
But all of these things are more expensive, and the worst type of foods are much more cheaper. Yes, so the government should work on that side of it. And in regards to what I would say about those people that say that they can't lose it, reach to a physician whether they need behavioral therapy. We can try to help with them. Or if they can't lose the weight, there are medications that can help. And I'm not saying go on these medications such as Ozempic, Mounjaro forever. Like for my patients, I know once you come off these medications, you do gain the weight back, but there's better ways to come off of it. Do your lifestyle changes? Yes. And once you're ready to wean off these medications, you've hit your target goal. Instead of doing weekly injections, maybe do an injection monthly, and then maintain a new standard that you've set for yourself, a new weight baseline, and then slowly wean off of it month by month. You can stop the injection slowly, but we can help them if they need.
And that's where I see the value in something like that. because some people need to see that initial change in their body, right? They need to see some kind of benefit. And then that quite often will ignite the spark in them where they're going to keep going. And for that, I dig it. Like, I think that's important. But I can't believe that someone who is like out of work, not out of shape, and just so tired of their life, that the problem is they get into that funk that they can't get out of it. And I sympathize with that. And my wish for those kind of people is just start doing something. Like, I know someone who's very lazy and they don't want to do anything. And I'm just like, just go for a fucking walk. Go to the fucking end of your driveway and come back. Start. Take one step.
Yes.
Just start doing something. And then that will translate into something else. You know, instead of going to the driveway, I'm going to walk to the mailbox. I'm going to walk to the block. Success that's a drug, right?
Yes.
Excelling in your life, getting better at something, and not just physical activity. Like right now I'm taking chess lessons. I'm taking Spanish lessons.
Good.
So every day that I learn something new, it excites me. It motivates me to do something more. But as I've said many times on this podcast, motivation is great, but you need to start developing the discipline, because you're not going to be motivated every day.
Yes.
You need that discipline to, when you don't feel like it, you need to still do it.
Yeah.
So
Yeah, but Bruce, the problem is like it's not easy living in Canada. Like the cost of living is so high. So
I know.
people are working like nonstop, and you know. But the problem is they have to understand that just because they're working 12-hour shifts, they need to take an hour, a couple of hours for themselves during the day.
I agree.
And they need to do this because not only are they should do it for themselves, but then they should do it for their children, their wives, or the wife should do it for their children and their husband. So, but the cost of living is not easy in Canada.
Dude,
Yeah.
I'll go to the supermarket and I'll boot my fiance. I'm like, what the fuck is this so expensive?
But you don't look at prices.
I know.
And not-
So the odd time that I do,
Yeah.
I'm like, how the fuck do people live here?
Yeah, exactly. So for those people, I would say, listen, we understand what you're going through, but the thing is, they have to make sure they, for the sake of their children, because it's a thing that affects your children, and then their children, then they're lazy, then they're obese. So it's like, that's how this starts, right? So you have to do it for not only yourself, but the people around you. So that's what I would say to them. They have to find the motivation to do it for themselves, but their people around them would love. But yeah, the government's not helping, so you have to be on your own side.
Yeah, agreed. And if you want to go down that road, why do you think our government is purposely trying to keep us sick?
I would take it back to pharma companies. I think, like I said, people, there's wrong people in wrong positions. I think it's all a money game personally. And even nowadays, like I do sympathize around the world. Like I know we're supposed to be helping people around the world, but I think as Canadians, we should help. We have a lot of problems here. We should fix them. I don't know where the money's going, or where our tax money is going. I think it's going everywhere, but towards the right things in Canada.
I agree. It's fucking mind-blowing to me that we're so quick to give out money to every other country. And while that's a great humanitarian cause, you need to fix your own fucking backyard first.
Yeah.
Like when I heard that veterans are being opted out for maids as opposed to mental health therapy, I was disgusted with our Canadian government because of that.
Yeah. I mean, that's a different line. Some people might see that might be a good thing, but I think the focus should be more on prevention rather than ending life, terminal life. Well, sometimes you need bait, but I think the focus should also be spending more money on how we can prevent our population from getting sick.
I agree.
And it starts with nutrition, having gyms available for the public. It starts with that. And it does happen in Europe. You have a lot of countries that do provide that around the world. But I think we need to do that in Canada as well.
So going on the topic of maids, what's your thought on that?
I think it may be an option for some people. I have to look into it personally. I haven't looked into it too much. But I do think it's an option for some people. But I think funding should be more towards prevention than programs like this.
Okay. My personal perspective on maids is that when I'm ready to leave the party, right? Like I've lived my life in a certain manner. And I've achieved a certain amount in my life, and I don't want to be taken out slowly and lose my dignity by some disease. 100%, if it gets to the point where I don't want to die slowly. I want to make the decision on my own terms that it's time for me. I had a great fucking dance, so I leave the party, and I go out on my terms. That's my perspective on it. And I think we should be allowed to make that decision for ourselves, as opposed to some government official saying, no, you have to fucking just lay in the bed there in hospice until it's time for you to go. Fuck you. That's not my way.
No, I think it should be left with the patient and the family members. Yep.
Agreed.
Yeah.
All right, man. That was, fucking went deeper than I thought you were going to go.
Yeah, just with that way of, I don't know, we went from testosterone peptides to like mates. So I mean, it's fine. I think yeah, no, it's good to be here. But I think we touched on a few points.
Do you have one question for you? What do you want your legacy to be?
I want to help as many people as I can. That's the main thing. And I live right now, I have 3 kids. I live for them and just make life easier for them, but also like for people around the world, teach them as best as I can. Being a physician, I think we do have an important role, and I want them to understand their health is in their hands. Great point. Yeah, that's about it. I think prevention is the best cure, and just people to understand that. But legacy, in regards to legacy, I'm not too worried about that. I just want to be able to help my family, just be well off while I'm not there for them in the future. But that's it.
Amazing. Appreciate you, brother.
All right, man.
Thank you, Matt.
Thank you so much.
Be great.
Yes.